Good afternoon, I'm Gerry Mobbs, clinical psychologist. I'd like to offer you some information today about psychologists and how they can help you. The easiest way for me to do this is to answer some of your frequently asked questions about psychologists and how they can help. So the first question is, what is a psychologist? So psychologists basically study human behaviour. We study how people think, feel, act, and how they interact with each other. And as a clinical psychologist, working clinically with people, basically I help people in their lives to feel better, to make change, to better themselves or to move forward in their lives. The second question people often ask is, who can a psychologist help? Can they help me with my particular problem? So we see all sorts of people. I see all sorts of people presenting with a number of different concerns. The two most common reasons people usually come to see someone like myself are that they're having an experience that we might label as something like depression or anxiety. So people may have noticed changes in their mood, in their behaviour, in their energy levels, in their relationships. Sometimes people come to see a psychologist as well just because they're struggling to make a decision in their life, whether it's a work decision or a relationship decision, or they're unsure about something, or they've been through a particularly stressful time. They may have had a stress or a trauma. I also work with people who have had childhood trauma and significant long-term trauma. I help people manage stress and health and life balance, that kind of thing. I also have a particular skill and interest in working with people around their drug and alcohol use. And that may mean just wanting to make a change with how much you're drinking or your drug use or what kind of drugs that you're using as well. I've worked with people with eating disorders and a number of other disorders, bipolar disorder, psychotic disorders. One of the core issues I believe that underlies all of these things is usually about self-esteem and how we feel about ourselves and whether we like ourselves or accept ourselves. So I'm always working on that as well when I'm working with people. A third question that people often ask psychologists is, well, what's your approach and how does it work? There are a number of different therapies out there, therapeutic modalities. And for me, I believe it's not so much just the type of therapy you use that's important, but my aim in seeing you, for example, as a client, is firstly to really understand what's brought you here, to understand your experience, to hear you, to support you, to connect with you. So that's always my primary motivation. And so when someone comes to see me, I'll really have that in mind, and then I'll be assessing what approach is going to work for them, because I use a number of different approaches. Some people really like a lot of structure and homework and practice, and they want to know where we're going and what we're doing, and so I will cater my approach to that. And other people find the connection within the therapy room the most important thing for them. So I'll ask you and I'll assess that about what approach will be best for you. Some of the particular approaches I use are cognitive behaviour therapy, mindfulness, and schema therapy. People often want to know what the outcomes will be. If they come to see a psychologist, am I going to feel better? So while we can't give a 100% guarantee, people do often report feeling better through therapy. The key thing people notice first is increased self-awareness. They get to know themselves better. their thoughts, their feelings, their behaviours. They get to understand themselves better. And that is a really powerful thing, to understand what's going on for you, then helps you to make change. So people often will say an outcome of therapy has been a change that they've made, whether they've changed jobs or made changes in a relationship. They may become more assertive or start behaving differently. People often report specific outcomes like reduced drinking or weight loss, or feeling calmer, practicing relaxation more, having more energy, feeling that their depression's lifted. And also I'm always aiming for people on that goal about self-acceptance and self-esteem as well. So that's often an outcome that people describe from therapy. Individuals often have a lot of apprehension about the first session. What will the first session be like? Will I come into a crazy place and, and what will happen, and will you come in and read my mind? So the first session, you come into the clinic in the waiting room, and it's a very normal looking room with normal looking people, and I may just ask you to fill out some paperwork. And then I'll bring you into the counselling room, which is a very warm, comfortable place. And I'll basically talk with you about confidentiality, privacy, and really ask you what's brought you here today, and ask questions to help myself and you understand more what's been going on for you and how I'll be able to help. So in that first session, we'll usually formulate a bit of an idea of what are the key things that are happening for you and how I will be able to help. People often want to know the cost of therapy, understandably. My aim is to keep therapy affordable and accessible. And thankfully now, we do have a Medicare system where you can receive a rebate, a significant rebate for seeing a psychologist. You can get that from your GP. You need something called a mental health care plan, and I could always provide more information about that for you. People often want to know, well, how long will I have to see you for? Will I have to come for 10 years? Am I locked in? No, you don't sign any contracts, you're not locked in for sessions. I always aim to keep therapy as brief and effective as possible, and usually people will notice some results within 6 to 12 sessions. So people will often feel quite comfortable with that and quite happy and say, see you later. And other people will come for a longer period of time. I see quite a few people too for ongoing maintenance kind of therapy, where I may see them once a month or once every few months, or they phone me for a top-up session when they need to, or when there's a particularly stressful event that's happened in their lives. Another hesitation that people sometimes have is they ask, will I have to come in and talk about my childhood and everything bad that's ever happened to me, and will you pry into the deepest, darkest corners of my mind? No. So no one can make you talk about something that you don't want to, including a psychologist, and it's not helpful. So I'll never force you to talk about those uncomfortable things if they're there. Childhood often does come up through therapy when we're looking at childhood just in terms of if there's been things there that have affected the way you view the world now. We're all shaped by our upbringing. So I look at childhood only to the extent that it's useful for what's happening for you now. There's a lot of misconceptions too about the difference between psychologists and other health professionals. A common question people say is, what's the difference between a psychiatrist and a psychologist? So a psychiatrist is a trained medical doctor before they do their training in mental health, and a psychologist isn't. We have purely training in mental health. So psychiatrists can prescribe medication and psychologists can't. Having said that, I work with people who take medication, and psychologists are very familiar with medications, particularly antidepressants or the sort of medications used to treat mental health concerns. So often we can answer your questions or concerns or worries about medication too. You don't have to take medication to see me, and also you are allowed to take medication to see me. It is completely your choice and something you decide with your doctor. I work with people who've never taken medication. I work with people who take medication for the first time. And I work with people who've taken medication over a number of years. So it's very, very individual. What's the difference between a psychologist and a clinical psychologist? The basic difference is training. A psychologist completes a 4-year undergraduate university degree, and then they have 2 years of practical training. A clinical psychologist completes the same 4 years undergraduate university, plus a 2 years postgraduate master's degree, and then plus the practical 2 years training. So more university training. Medicare recognises this difference and provides a higher rebate if you see a clinical psychologist as opposed to a psychologist. What's the difference between a psychologist and a counsellor? People can benefit greatly from counselling. It's just not as regulated as a profession as psychology is. So there's not a minimum requirement to call yourself a counsellor, whereas psychology is a highly regulated profession. So it has very strict legal and ethical requirements and boundaries around it that we have to maintain to keep calling ourselves psychologists. And the last question that people often ask me too is about someone that they care about. So people contact me and say, you know, my partner or my friend or my mother needs help. Can I make them come and see you? So we can never force anyone into treatment unless they're ready. We can't make them, but if you have concerns about someone you care about, I can always have a session with you to really help you understand your concerns and what's going on. I can give you advice about what I think might be happening for the person that you're living with or caring for, and I can help you formulate a plan that might give you more success about how to approach them or encourage them into treatment too. So I hope these questions have been helpful for you to give you an idea about psychologists and the kind of work that we do. I love being a psychologist. I love the work that I do. I love working with people, and there's such variety in my work, and I bring that passion and interest and pride about my profession to the work that I do with clients. So I look forward to hearing from you. You can look me up on my website, gerrymobbs.com.au. There's an email address on there as well. And I have a number of other YouTube clips as well. Have a good day.